Hello and welcome to Unstress Health. My name is Dr. Ron Ehrlich. Well, today we are exploring the pandemic, and I think although it doesn't seem to find its way into very much discussion either in governmental, in public health, in professional organisations, or even in the media, it seems to have been brushed under the carpet. It is a subject that I think we could all describe as a collective trauma, certainly an opportunity for global reflection, and I think we have a great deal to learn from it, both positive and, sadly, a great deal of negatives. My guest today is Dr. Julie Sladden. Now, Julie is a former medical practitioner. She's now a health advocate, and she is a courageous voice for transparency in healthcare, something I think is sadly lacking. Julie has been an outspoken about the need for genuine reckoning following the COVID pandemic, highlighting the profound failures in public health policy, leadership, and institutional trust. Now, drawing on her recent piece, which she wrote called The Reckoning That Never Came, we'll explore the societal, economic, and personal impacts of the pandemic policies, the erosion of trust in healthcare authorities, and why honest conversations are critical for each and every one of us, and also for a national healing and reform. This is an issue, sadly, I think, which is very relevant in Australia, but not really being addressed in Australia, but it is definitely a conversation that's happening in the United States. We touch on some of that today. I hope you enjoy this conversation I had with Dr. Julie Sladden. Welcome to the show, Julie.
Thank you. It's great to be here, Ron.
Julie, I read your article that was called The Reckoning That Never Came, and I was reflecting on that, and that's why I invited you on. I wanted to talk about this issue as we reflect back on the pandemic. I mean, what motivated you to call for a pandemic reckoning, and how's your view evolved over the past 3 years?
Well, it's a good question. It was actually a topic that I first wrote about over 3 years ago now, when I first started writing in the wake of the pandemic, and it was just coming up on the 2022 election. And I realised that one of my great fears was that we wouldn't talk about what happened, because I'd noticed that both of the major parties in their debate in the debates that they hadn't mentioned the pandemic at all. And I thought, how can they not? This is 2022, so we're still very much in the throes of everything that was going on. I thought, how can they not be talking about the biggest thing that has affected people, including health and fiscal policy and social cohesion? How can they not be talking about it? And I thought, wow, what if they never talk about it? And that kind of thought didn't even really bear entertaining, but I did. I wrote about it. And so I wrote about what should be in a pandemic reckoning. You know, that was my kind of like, this is what you guys should be talking about. And it was all of the things, I guess, that should ever be included in a Royal Commission, if there ever was one as well. And so here we are, alarmingly, 3 years later, and it's still not really happened. I mean, we've had some various Senate inquiries into, developing terms of reference for a Royal Commission, and we've had, evaluations like the Labor government's COVID inquiry, which was very much the inquiry that you have when you don't really want to have an inquiry, but nothing really that's answered the questions that or addressed the issues that have been ongoing since then. And They do that at their peril, because the people haven't forgotten. And it's not just that, the people in Victoria who were locked down terribly and had their businesses decimated. It's all of Australia. You don't need to go that far to see just the carnage, and it's fiscal, it's social, it's educational, the health system, and, every problem that we had has been made worse. And if we don't actually name up the elephant in the room, then what?
Yeah. I mean, it is quite, I have been following the story of corporate capture in healthcare for almost 40 years. And it's something it's not new, although to many it is new. And even I was shocked by the level of capture, because that's really what it was. It wasn't following any kind of plan, and the collective trauma we all experienced at various levels was extraordinary. I'm intrigued, though, Julie, because your background is medicine. You are a doctor, or you have been a doctor. Tell me about your journey as a doctor. I mean, how would you describe the way you practiced medicine up until that point in the pandemic?
Yeah, well, that is a story in and of itself.
I'm intrigued by those stories, Julie, because they're transformational for many practitioners, but sadly not as many as there should be.
Yeah, and I think I've always said, one of the best educational experiences I had in medicine was being a patient myself. And I think it was that experience that really positioned me to see that some of the things that were being done as part of the pandemic response were counterintuitive and weren't really setting people up to be healthy, which has made me what made me look into it further. We've had a lot of terms bandied around in the last few years, conspiracy theorists, anti-vaxxers, misinformation, blah, 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 call it what you will, but you have to be prepared to ask questions. And when I was practicing medicine, as we entered the pandemic, I very much was practicing in a way that, I'd been forced to ask questions about the education that I had, the way that we were being trained, and that was simply because I'd actually been forced to go and find my own answers. And it started, I've always been very fit, very healthy. I've loved the outdoor lifestyle. I've, never smoked, never been overweight, love sport, love eating, healthy. And so you can imagine my surprise when I developed breast cancer at the age of 39 with no family history.
Wow.
And what then followed was a series of unfortunate events that forced me down a path of actually looking at, well, what is health? What is real health? And, without boring your listeners too much, I had a few health adventures along the way already. I had a blood clot when I was pregnant. I had a grumbling autoimmune condition that nobody really seemed to know what it was, but that was okay because I just managed it with anti-inflammatories and carried on and didn't really pay it much attention. And then this cancer diagnosis, which just came out of the blue, which is really, when you say the word cancer, everyone, you feel a bit ill. And I certainly did. I thought, what is going on? And that was back in 2013 that I had that diagnosis. And went through all I had surgery. Fortunately, I was able to avoid chemo and radiation. Although the plans changed many, many, many times. And after about 12 months, following all of this, I was actually getting sicker. Not from cancer, because essentially I was cured, but my autoimmune disease had taken on a whole new life to the point where I was on about a dozen drugs.
Right.
As well as being in an enforced menopause. I developed a minimal trauma stress fracture because then I became osteoporotic. Osteopenic. I didn't quite make it to osteoporosis. And I had terrible, terrible pain. And I just remember one day thinking, this is ridiculous. I'm getting sicker and I shouldn't be. If I extrapolate down this path, by this time I was 42, I thought all I can see is this is getting worse and I'm going to end up on more drugs to manage the side effects from the other drugs. And I had a family member who, was knowledgeable in gut health. And so I spoke to them. It was just an off-the-cuff kind of conversation. And they said, oh, maybe you should go and have a look over here and go and read up about that. And I'd always been interested in nutrition and things. And that really did set me off on a path of reading and learning and discovering some very knowledgeable people out there who've been looking at health from what I would call now a real holistic point of view, not just symptom, diagnosis, drug,
Yep.
which is the way that
Because what you were experiencing, Julie, was standard of care.
Mm.
I think that's worth mentioning to our listener, that you weren't experiencing anything out of the ordinary. In fact, quite the opposite. You were experiencing what is considered in modern medicine standard of care.
Yeah.
And I presume the person who knew a little about nutrition wasn't a doctor.
True.
Okay, we're just laying down some foundations here, because I do think it's interesting to talk, and I've spoken to many doctors over the years on this program, about the transformational experience their own diagnosis had on their practice of medicine.
Mm-hmm.
It's not an uncommon story.
It's true. I think there has to be a catalyst event to make you go looking a little bit further afield. And it's not as if you're looking in weird and wonderful places. Sometimes it's just actually researching papers that, look at, what do we know about the gut microbiome, or, what do we know about vitamin D, or, vitamin D was something that I had incredible deficiency in. My vitamin D was in my boots when I was diagnosed with breast cancer. And I know that was one of the things that contributed to my immune system not working very well. So it was almost like, and what followed was about sort of a 6 or 7 year period of getting myself back to a reasonable level of health, no longer on any medications, and a completely different way of living. But it was like doing another whole medical degree. And I did lots and lots of courses. I did a 12-month nutrition course. I did some of the training through ACNM, the Australian College of Nutrition and Environmental Medicine. They did some great courses there.
Julie, I'm the immediate past president, so
yeah, I know. I recognise you from somewhere. Yeah.
So it's good to hear you put a plug in for ACNM, the Australasian College of Nutritional and Environmental Medicine. But do go on. Yeah.
Yeah, and I just really pieced together my own sort of choose your own adventure training, which was tailored to my health problems. And by doing so, I kind of learned a lot of things that would help other people along the way. So my medical career, as it was, has always been a bit of a choose your own adventure, because my husband's a doctor as well. And, when you're in a 2-doctor family and you've got kids, you often find that one of you is a little bit more kind of, flexible than the other. And so I've worked in and out of general practice a number of times. I spent 8 years in emergency medicine, which is where I was when I was diagnosed. But when I returned to medicine after that period of ill health, I was back in general practice. And I started getting patients who had similar problems to me. And then they would tell their friends. And then soon enough, local GPs who don't have the time to practice in that way would be sending their patients to me. And so when the pandemic arrived, I was essentially doing nutrition and gut health and doing longer consultations, and my patients would come and see me, and we'd just, work out what was happening in their life and get them back to some kind of even keel. So it was very rewarding. It was very hard because you're dealing with helping people change habits of a lifetime. Yep. But usually by the time they got to me, they figured it was that way or no other way. So that's really what primed me, as it were, to see some of the responses that we were doing in the pandemic. I actually was telling a friend about this recently. I said, I remember what I was doing and where I was when I all of a sudden realised everything that they're saying to the public is actually setting them up to suppress their immune systems. And that's not what we need right now. Stay home, stay frightened, stay indoors, don't exercise, binge watch Netflix, drink alcohol and junk food, and separate you from all your loved ones. I mean, talk about you want a way of destroying the immune system. That's a pretty good start.
Yeah.
And that was pretty much when I sort of started looking into it a bit more and asking a few more questions.
It's interesting because you talked about your trauma of diagnosis and what a transformational experience it was. And very few people could argue with the fact that the pandemic was a collective trauma for us all. And you raised some critical questions about why pre-pandemic plans were abandoned. You know, in your view, I mean, we don't seem to have learnt a great deal from this trauma. In your view, what were some of the most damaging deviations from those pre-pandemic plans, and why weren't they, and in fact, why aren't they being debated openly today?
Well, that's the $50 million question, isn't it, really?
I would say, actually, it's the $100 billion question, but
yeah,
yes.
That's closer to the truth.
That's a little more accurate, but it's a $100 billion question and answer. But no, really, there were plans in place, pre-pandemic plans in place. They were abandoned, really. What were some of the plans that were there that were not followed?
Well, I looked into this in, it was around about 2021, I think, and I thought surely there are some pandemic plans, and sure enough there were. They'd been recently refreshed as of August 2019, so they were fairly, hot off the press, and they mentioned nothing about mass lockdowns of healthy people. There were, staged responses and, ways of isolating cases and things, but not this mass lockdown of people. It was very much more graded and systematic. It didn't talk about mass vaccination of healthy populations. It talked more about the focused protection of at-risk groups and, contact tracing and things like that, some of which we saw. But it was such a deviation from what we actually saw to what was written in the plan. Was just such a deviation. There's no way the two things, could exist together in the same room. And it was very much closer, our plans were very much closer to what was espoused in the Great Barrington Declaration, which some of your viewers may be familiar with Professor Bhattacharya.
Just remind us. I mean, that was something we have spoken about, but I think it's worth reminding our listener about the Great Barrington Declaration.
Yeah, so that was, I think, put out in October 2020, and it was by three very well-respected epidemiologists, Sunitra Gupta, who I believe is from Oxford,
yes,
in the UK, Professor Jay Bhattacharya, who's a professor from Stanford, and he also has he had a chair in economics as well, as being a medical doctor and epidemiologist, and Martin Kulldorff from Harvard, I believe. And there were a lot of people also in the background. I've since learned a little bit more about that. Scott Atlas, I think, was very much involved, around all that at that time. And Jeffrey Tucker, who runs Brownstone Institute, a lot of good articles on there. Mm-hmm. They really wanted to, they noticed that everything that was being, said was actually not what the literature had been saying. The pandemic literature, which we had for 100 years, was not being followed. And they also had, by that stage, done some studies, John Ioannidis and co, and I think Professor Bhattacharya was one of the authors on that paper. They actually did some studies in the American population in spring 2020, so very early on. By April or May 2020, they knew that it was out in the community, the COVID virus is in the community, and the the infection fatality rate was somewhere around 0.02%, like it was really low.
Yes, which, to put it another way, was you had a 99.98% chance of not dying.
Yeah. And what that study also showed was who was at risk, and those who were at risk were the elderly and those with multiple comorbidities. So they got together around the table and said, look, this consensus of mass lockdowns of healthy people is not what we should be doing. We should be doing focused protection on those that are at risk, so the elderly and those with multiple comorbidities like diabetes and things like that. And we should be letting the rest of the populations get on with their life, because we know the research shows that the cost of lockdowns kills people. The cost of locking healthy people up kills people, and preferentially it's the poor and the vulnerable and the children. And I remember I actually had the opportunity to interview Professor Bhattacharya, and he said, the day they went into lockdown in India, he said there were 1 million people, basically, that it was responsible for 1 million deaths, that lockdown. And it just blew my mind that, there's no talk about the number of deaths that happened because of the mass lockdowns. And the schooling and education as well. The children who go through lockdown or are locked out of school, they never fully recover those educational years back. And we're now starting to see that filter through our education system now, where I had a teacher say to me the other day, "Julie, have you interviewed any of the kindergarten teachers right now?" And I said, "No." And they said, "Well, you should, because the children that are now entering kindergarten are the 2020 babies." And they're seeing some very alarming things. So that's a TBC conversation that is going to have to happen. And this is where I'm talking about. There are so many downstream effects of the things that we did, economically. We've got this inflation. Now, I don't know how COVID is not a part of that conversation, because what was done economically was basically to set us up for this inflation that we now have. We have the healthcare system, which hasn't fully recovered from the mandates. And then, of course, the vaccinations, that some people left their workplaces because of that. We all know, I'm sure your watchers probably are aware that, people have been injured by those. Some of those are not able to go back to work or are struggling and have reduced capacity. I know people like that in the healthcare industry. So that's another, way that we're sort of struggling through. And so by not going back and looking at, what we actually did versus what we should have been doing based on, the evidence, which is, like I said, what the Great Barrington Declaration espoused: focus protection and let healthy people get on with their lives. And just like to say, about 1 million people have signed that document now, including Nobel Prize winning laureates and tens of thousands of doctors and researchers and scientists. I mean, that was the real consensus that was silenced, that was censored from the mainstream media, and we're still not talking about it. But if we don't talk about it, not only are we set to repeat it, but there's absolutely no way that we can even begin to approach what has happened and how to dig ourselves out of this mess.
I mean, I'm amazed that, the pre-pandemic plan, which, as you said, had been updated as late as August 2019, presumably the very people that made the public health declarations during the pandemic were involved in that planning. Would I be right in this? It must be right, because who else would be involved in a pre-pandemic planning than chief medical officers and public health and epidemiologists and economists? They were all involved. Well, I just cannot understand what happened that changed everything.
I think, that's very much a specific conversation that needs to happen as well, because that's a question that just hasn't been answered. It hasn't even been discussed. So, tell me, I often wonder, did somebody get a memo that the rest of us didn't get? When was the decision made that we're not going to follow the pandemic plan, we're going to do this other thing? And some people, hypothesize, we followed China because, China was locking people down, said they're on top of it, and so we all followed their lead. I don't think so. We've never before seen the world all be so cool. I mean, so many different countries in the world were all doing the same thing. It just, without wanting to sound like a conspiracy theorist, but you just think, was there a memo that we all missed that was being used to? I don't know, but the question definitely needs to be addressed, and it's one of those components of the reckoning. Why do we diverge from it. And I think I looked up the pandemic plan a little while ago, and they haven't rewritten it yet. So I'm kind of like, well, what's going to be the next iteration of that?
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Well, I think the word conspiracy theory doesn't really do it justice. I think if you use the words business model, it seems to make a lot more sense. Erosion of trust was an issue. I know there was an article in the American Medical Journal which said prior to the pandemic, trust in physicians and hospitals was at about 70%, and now the number is at 40%. And I think that is probably the case more in America than in Australia. I think the conversations have gone on more in America than they have here in Australia. Would you agree with that?
I would agree with that. And I think I saw the same article. And the longer that this lack of open conversation happens, the less chance we have of rebuilding that trust. You can't have trust without transparency. There's been very little transparency. They can't expect to build back trust without answering some of the hard questions and that collective trauma that people have gone through. To not even have, grievances aired. We've seen, people who've been terribly injured by the vaccine, and still we have there's nothing to see here. Safe and effective. And I think that's not the most true iteration of the conversation that should be happening right now. They're blaming the drop-off in vaccination rates in general. And, obviously the flu vaccine and getting your COVID booster is being heavily promoted at the moment, and they're not getting a lot of uptake. And I think that pretty much tells you the barometer of where the people are at right now. They're voting with their feet. So these are those unanswered questions, and this also, I think, really demonstrates a lack of trust that's there. I know people who now say they wouldn't go and see a GP, or they wouldn't go to a hospital, because they just don't trust the system anymore. So we have a real problem, and we have to have those conversations if we want to build the trust back.
No, I completely agree. I mean, you highlighted that the mandates and the tension between personal autonomy and public health mandates. You talked about that. How should we as a society balance out those kind of individual rights with collective responsibilities moving forward? Because, I guess we live in a community. We want to have our personal freedoms. I mean, this was one extreme example of having almost all personal freedoms removed. There's got to be a balance there somewhere, hasn't there?
Yeah. And look, the best point I can think of is one that was given to me by Professor Bhattacharya, and he said mandates represent a failure of public health. He said if you've got to mandate people to have a vaccine, then public health has failed. It should be so good and so, safe and so effective and so open, and it's, people's that they're actually lining up to have it. And, I've been called an anti-vaxxer. I've had more vaccines than most people, and then some, because I've travelled quite extensively as well. Yeah. And, where treatments work and, a therapeutic intervention works, I'm the first person to put myself there to, so I'm not weighing down the health system, and that's why I take responsibility for my own health as well, because I see that as my duty so that I'm not, taking up unnecessary resources. So anyone of any, responsibility will do that. So when they mandated it, I think there was this line that was crossed, that they really didn't consider the adverse effects of actually mandating, because there was a breach of trust that came from that, and it went from being we're all in this together to it's you're either in this or you're out, and the ostracizing then of people who decided they couldn't give informed consent to the vaccine. They were then essentially some of them gave up their jobs in order to do that. They were also ostracized by members of the community, and also socially, politically. Some of the most appalling displays of professionalism I've ever seen in my life was watching some representatives of doctors' organisations on the news basically saying, if you don't have it, you're making your life very difficult for yourself, and some really coercive speech that I just, and I did, I've done training in medical education, and my area of interest was professionalism and ethics and informed consent.
Right.
And I remember watching this and just feel a colour drain out of my face, thinking, like, the whole population is being coerced, and it was, it was just appalling. And so there's a collective trauma that stemmed from all of that as well. And it's not as if there's no evidence about this. There's actually a paper that I sourced, I think it was from 2019 or thereabouts, which basically said mandate vaccines with care. And it was talking about the childhood schedule and the risks of, mandating versus, the carrot and stick approach type thing. And, it said there's a line whereby once you start to force people, make the percentage of people who, sort of, on the fence about it, you try and push them too much and they'll go the other way. And we saw that happen en masse. Now, as far as the responsibility to the community, I have a real problem with that argument in that it's flawed from the position of the assumption that the vaccine prevented transmission.
Yes.
And it never
Which
did.
they knew it didn't.
They knew it didn't. They knew before it was mandated that it didn't. And I've got the emails to prove it. The emails were FOIA'd, so they had that conversation. And that's the problem. You have to understand a little bit about the bureaucratic processes. You need to understand a bit about medicine. You need to understand, they've never really invented a respiratory vaccine, at least, that's been able to stop transmission. When you have a vaccine, it prevents the person, it helps the person. It's for the person's protection.
Yeah.
And so that was never really the basis for, for getting vaccinated in the past. So this really big push to get vaccinated to save grandma, was just one that we've never seen before.
Yeah, and to isolate the person who wasn't vaccinated and say you're potentially threatening our community, where in fact, if the vaccine was effective, it was they that were taking the risk themselves. They weren't. You're fine. You've been vaccinated. What are you worried about? You're vaccinated. You're safe, aren't you?
Yeah,
and I'm the one that's going to take the risk. Exactly.
And I remember when I decided that I wasn't going to have the vaccine, and I thought, well, I can do telehealth. Well, as it turned out, our mandates in Tasmania were so stringent that you couldn't even do telehealth, so you couldn't provide any health service.
You could not even provide a health service online unless you were vaccinated.
It's completely illogical.
Wow.
Wow. So it really felt punitive.
Yes.
And I remember saying to somebody, don't worry, if I get COVID, I'll just take myself off to a room somewhere. I promise not to burden the hospital system. But, by that time we kind of in 2021, we knew things that would help. We knew who was at risk. I knew I was healthy and I was at more risk because given my personal medical history, from having the jab than I was from the virus. So I think, and this is the thing, everybody needs to make the correct decision for them. We've never before seen people recommending that, children be vaccinated with something that we don't have medium to long-term safety data on, or pregnant women, we don't have medium to long-term safety data. We, in order to protect the population that's at risk, the older population, I mean, it's almost like the people who we should have been protecting were being used as a shield. And like I said, there were so many things that just got thrown out the window. It really made me despair of what the medical profession and the bureaucrats and the political class were doing.
I noticed that you've used the term media outlets, and I no longer use the term news outlets, particularly since the pandemic. It really was such a coordinated response between government, professional organisations and media all singing to the same tune. And any question about safety of a pharmaceutical product, which vaccines are, was considered to be anti-vax. Or, if I was concerned about a pharmaceutical product, would I then be deemed to be anti-pharma? Well, probably I would, but it was so coordinated, wasn't it? Looking at Sweden was an interesting point in case, wasn't it? Because people often cite that and cite it in a way that I don't think they've looked at the statistics. What lessons could we learn from Sweden, who didn't lock down? Did they? I don't think they did lock down. Yeah, what were some of the lessons we learnt from them?
Well, interesting case, because I don't believe they had their own pandemic plans. I believe they followed the UK's pandemic plans, which the UK themselves didn't follow. And they, they basically let people, choose their movements. They didn't do mass lockdowns. I think one of the things that they didn't do so well, they sent elderly people who got COVID back to their nursing homes. And so I think they ended up with a little, spike there in the older population. So they possibly could have handled that a bit better. I'd just like to say I haven't looked closely at their data, so this is more commentary that other people have provided. But as far as like long-term effects from the lockdowns and, mandates and things like that, they're not suffering from those. They also don't have the economic hangover that the rest of us all have as well, because the lockdowns had devastating effects on our economy, just from the point of view of, businesses. And it was fine, I use that term relatively as well, for the laptop class, those who could just do their job at home whilst cooking dinner and homeschooling their children as well. Whereas, the bricks and mortar people who, like especially in hospitality, they were decimated, retail was decimated, money was printed to keep people at home. Never before we, printed money to keep people at home. And, we wonder why we've got a cost of living crisis right now.
Yeah. You mentioned the appointment of Jay Bhattacharya, who, as you said, is this professor of epidemiology and economics at Stanford. You also mentioned John Ioannidis from Stanford, and it's worth noting that he's the most cited author in history. In fact, I think if you get an article published and you get 100 or 200 or 1,000 citations, you're doing really well. He's had 200,000. So, he's well regarded. But he's now the head of the National Institute of Health in America. What qualities do you think future health leaders have to restore, faith, trust, and integrity in our organisation? I mean, what do you think needs to happen?
Well, I think Professor Bhattacharya is probably a very good example of what we need to have in our health policy, our health bureaucrats, our health leaders. Now, I mean, he has basically earned his stripes, as it were, the hard way. And, by speaking up. I remember him saying, if I can't, as a Stanford tenured professor, speak up, then who can? He saw it as his duty, but it wasn't without cost. He was persecuted. He was taken through the mill by his own university, I believe, and just suffered some terrible, attacks on his credibility. And, to see him rise to be head of the NIH now, it really is probably one of the most encouraging things that I have seen in the last 5 years. And what do we need from our health leaders? We need integrity. We need honesty. We need people who are actually prepared to say the hard thing, to ask the hard question. And I know that in his speech to the Senate when he was having what do they call the session where they basically grill them?
Yes.
And he talked about, freedom of speech and freedom of scientific discourse. We need to be able to do that. And that was what suffered tremendously during that period. And it was Scott Atlas as well, who I spoke with. And, he's actually helped to set up a organisation called the Global Liberty Institute, and they are training up, young leaders. Many of them are already sort of blooming leaders, but the younger generation to be able to, work in these spaces. And one of the questions that they ask them is, what have you done to show courage? So we need courageous leaders. We need the people who are actually prepared to sacrifice their careers, their reputation to do what's right.
Yes.
And it alarms me even to have to say that, because it sounds so poetic and like it's out of a movie, but it literally is as simple as that. We need people who are not scared to risk everything to say what's right and to do what's right. And I've been greatly encouraged over the last few years because, I've met some amazing Australians in the health professions and in the medical profession even, who have kind of helped to restore my trust that there are people out there. Many of them were just silenced, but they've been very courageous. My story is just like this compared to some of what people have gone through. But we have a lot of courageous people out there, and they're the people that we need to be putting in the areas of leadership.
Well, speaking of those in areas of leadership, we did a program in 2022, which was about 2 years after the pandemic started, and the Australian government put on a forum for early treatment of COVID. Now, you were in emergency, and I think it's good to get, if there's a problem, get in for the first 24 to 48 hours if there's a medical emergency. So I think we could agree that 22 months is not what we would consider early treatment. But the only treatment that was discussed was newly patented drugs. And this was Brendan Murphy, head of the health department, Paul Kelly, the chief medical officer, Michael Kidd, John Skerritt, the head of the TGA. These were all our leaders in the public health field, who I believe many of them are still our leaders in the public health field. Would it be unfair to say we just need a big broom to sweep out the rubbish?
I wouldn't mind a broom to give things a bit of a clean out.
You talk about, Jay Bhattacharya is a good example of a highly qualified person who displayed courage, who is now put in a position of authority. Are we seeing anything like that happening in Australia?
No, we're not. No. And that really concerns me. You really do have to look at what's happening in the US. Trump has been a big disruptor. I think pretty much both sides will agree on that. But what we've seen is some really thoughtful appointment of people, especially in the health and human services space, and with Robert Kennedy Jr., Dr. Marty Makary, who's the head of the FDA now, and Professor Bhattacharya, the head of the NIH. And the thing that encourages me is that what happens in the US tends to filter down to Australia. So as far as information flow, I think we're going to see a lot of information flowing our way that the mainstream media will not be able to ignore this year. We'll
see. We'll see.
We'll see.
We'll see.
But as far as seeing a similar move as a cleaning out of the bureaucracy within the health political spaces, I'm not seeing that. I'm just seeing almost like a digging in, and we've also got the revolving door of, people who move up to the higher echelons of the political bureaucracy. They then kind of go off and get a nice high-paying job in, one of the pharmaceutical companies, or Medicines Australia, or heading up mRNA stuff. You don't have to look too far to see what's happening.
No, we did a program with a professor of pediatrics who at the time when people were advocating for children to have vaccines, and I knew that they were very low risk. I mean, talk about almost zero risk of dying from COVID. I said, how can you justify using an experimental vaccine on my grandchildren, on 5, 6, 7, 8-year-olds? And he said, how will we know it works if we don't try?
I saw that.
What a statement. What a statement.
Unbelievable.
It is quite frightening. Look, a couple of things, quick questions I wanted to ask you. If you had to pick one word for the Australia's pandemic response, what would one or two words be that comes to mind for you?
Atrocious. Devastating.
Yeah. No, that's pretty good. Have you read a book or an article, or is there a particular figure who influenced your thinking most during the pandemic?
I read The Real Anthony Fauci pretty early on.
Yes.
And
I did too.
Yeah, and that was because it was so well researched and so well referenced. So that, for your watchers, it's a book by Robert Kennedy Jr. Again, and it does really open your eyes to a lot more. I mean, I thought I was pretty sort of aware of some of the things that were going on, but I was a lot more aware after that. So that really did deepen my knowledge about the breadth and depth of some of the corruption that's been going on. And now that we're sort of all looking at things a little bit more closely, you don't have to go very far to see the similar patterns emerging in different areas of, the pharmaceutical industry, and then, the way things are being regulated, and vested interests, and that pattern as well. But definitely that book, The Real Anthony Fauci, was a good one, and we've seen so many good books come out. Dr. Claire Craig's book, the name escapes me now. Her book was very good. Ramesh Thakur has written a very good one, My Government, My Enemy. And, there's some real...
It is interesting with that Fauci book, and, people have very polarised views of Robert Kennedy Jr., and in my experience, if they have never read or listened to anything that he's ever said, they feel he's some kind of a nutter. And to anybody that has bothered to listen or read anything that he's written, you can't help but be impressed. And obviously, President Biden was impressed because he gave Anthony Fauci a presidential pardon in advance, dating back to 2014. So I guess RFK mustn't have been too far off the mark if President Biden was feeling strong enough to do that. That's being hopefully a little bit positive, Julie, if we can be. What's your biggest hope for the Australian healthcare system in the next few years?
Wow, that's a good question. I do like to be hopeful too, because I think there's always hope, and I think we have that's the best way to go forwards, and not just to. And by going forwards, I don't mean forgetting the past, but learning from it. And if the government aren't going to be responsible for the reckoning, I think the people will do that themselves in their own ways, all the way from, community groups and, families. They'll find their way of doing the reckoning. What would I like to see in terms of health? Well, I call COVID very much a great reveal. And it was a great reveal in so many ways about how people had outsourced their healthcare to the government, that we allowed the political class to stand on, get up on TV every single day and tell us how, as a population, how to manage our health without there being any real sort of public health messaging. And I think it has woken a lot of people up about what is really health, where does your health come from, what things do you need to do to stay healthy. And so I've seen pockets of, like highly motivated groups, get together and actually start to talk about, ways that they can live that is sort of taking responsibility for their own health by doing just the positive lifestyle, measures, or growing their own food, being less reliant on, having to, reliable. If something goes wrong, I'll just go to my, doctor, or I'll just go to my hospital. And sure, that's part of the healthcare system, but it shouldn't be your first port of call. And so I think we've seen an explosion in people sort of really looking into, gut health. We've seen an explosion of people looking into, good nutrition, growing their own food, which means they're getting outside, they're being more active, and just being more self-sufficient in general. And really, realising what the important things in life are. So people who were used to basically just running on empty all the time, they all had an enforced break. Now, if there was one positive thing that came out of people being locked down, this is me sort of really scraping the...
No,
I like to be positive.
I think I know where you're going, and I agree with you. Go on.
They were forced to actually stop and be at home and have a good excuse for being at home, and realising that they couldn't keep doing what they were doing the way that they were doing it. Yes. So for some people, it's actually been a reset in their values, or discovering that, or if they've gone through the horrible trauma of not being able to be with a loved one, through like a death. I know that happened a lot of times, or in weddings or a birth, that they're really valuing those times and those interactions, because, we're human beings. We are designed to be together, live in community, and to love and support one another. And that is such an important part of health. And I think people really realise that. And some people are living their lives differently now. So I'd like to see in health, when I talk about the health system, I would like to see a greater movement from the people towards what is real health. Because when we look at what it is that, the government provides, and that's a part of what the government's role is, to provide sick care services, and may they be just those, may it be an efficient sick care service, while we actually, as far as the Australian population, have a more healthy population, because we've learned how to do those things better. That's what I'd like to see.
Well, I think that's a great note for us to finish on, Julie, and I want to thank you for your courage and your, the things that you're doing, advocating for change, which we both agree is just so necessary. Thank you so much for joining us today.
Thank you so much for having me, Ron. It's been a pleasure to be here.
Well, it's a confronting subject. It's confronting if you actually choose to explore beyond the mainstream media, which could be the Sydney Morning Herald, The Age, The Guardian, the ABC News, SBS, or any of the other news outlets here in Australia. Now, Julie had mentioned the name Scott Atlas a few times there, and I thought I'd just share with you that Scott Atlas is a medical practitioner. Well, he's actually a health policy researcher. He's the Robert Weston Senior Fellow in Health Policy at the Hoover Institute. I think that is in Stanford. And he was President Trump's advisor very early on. He didn't last very long there, because he was a voice of reason, which was quickly shuttled out of the White House by the real Anthony Fauci. Interesting, wasn't it, that he received a pardon from President Biden? There were actually no charges laid, but Biden probably read Robert F. Kennedy's book, The Real Anthony Fauci, and felt compelled to provide him with a pardon dating back to 2014, when he started against American policy research in the Wuhan virus for gain of function research. It was outlawed in America, so Fauci moved it to Wuhan. But anyway, Scott Atlas was quoted as saying, "The pandemic response was the most unethical, the most tragic breakdown of leadership in our lifetime. And oddly, it remains the elephant in the room. In many cases, people don't want to talk about it." And I couldn't agree more with that. And I believe in Australia, somewhere between 80 to 90% of the population still will fall into that category. They would review the wonderful way the lockdowns worked, how many lives we saved, and what a wonderful innovation it was to have mRNA vaccine speeded through the approval process. The fact that there are some serious problems with it wouldn't have eluded too many people in my audience, but in the mainstream audience it would. The virus, he went on to say, the virus didn't cause the lockdown. Human beings decided to impose it, and they failed to stop deaths or transmission. So, look, there was so much to learn from that. I mean, Julie, I compliment her for being such an outspoken advocate for transparency in healthcare, something that is sadly needed. And as I said, I think we need a very big broom to get rid of the rubbish that is heading up so many of our public health institutions. I hope this finds you well. In fact, I would encourage you to join the Unstress Health community, but that's a message you're about to hear anyway. Until next time, this is Dr. Ron Ehrlich. Be well.
Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness, from self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.